here with Dawn, who's a midwife, who is my midwife.
Yay.
So fun. So if you want to just start maybe by just explaining a little bit about how you got started in this field and what kind of drew you to this.
I'm Dawn Dana, and I've been a practicing midwife for about 31 years in the Ventura community. Gotten to work with a lot of lovely families, like Ruby's. I wanted to be a midwife in high school. I just loved babies and pregnancy and the whole idea, and had a really strong pull toward the natural. And in 1980, actually, I got a hold of, here we go, the original edition of Spiritual Midwifery. I know, all taped, and fell in love with that. And at that time, the kind of midwife that I am wasn't legally licensed in California. There were certified nurse midwives, which is one path to midwifery that typically puts out a certain kind of midwife. And this is a different kind of midwife, much more naturally based, non-medically oriented. So I was either going to go study with Ina May in Tennessee and become kind of an outside the law midwife, not an outlaw midwife, outside the law, or go to nursing school and become a certified nurse midwife. Very interested in home birth. And so I started taking the prereqs. They're the same, you know, anatomy and physiology, microbiology, all of that. And I got pregnant with my daughter shortly out of high school. So my children have been my course changers. And I didn't think that I could be the kind of midwife I wanted to be, and a young single mom. And I work with a lot of young single moms, and you know that kind of like exploration, how is this all going to work? And so I had my daughter almost 41 years ago. It'll be 41 years ago this month. And I got care through midwives and had her in a birth center. But I decided to continue at the community college and just get the fastest degree that I could to support her. And we got really lucky. I got a lot of encouragement in college, and people said, well, you can't stop here. So I took my daughter up to UCSB with me, and we lived at family student housing. And I got a bachelor's in counseling psychology, and then I was working on a PhD in clinical psychology. And I found out I did not want to be a researcher. And I kept staying interested in birth. I became a childbirth educator and a doula. And I switched PhD programs to kind of like a counseling and developmental, actually, developmental psychology. So I was studying children and just kept having this call in my heart, but was sure I was going to be a professor. That's the path I was on. And then, let's see, 35 years ago, one of my friends had a baby at home at family student housing at UCSB. And then 34 years ago, the other friend had a baby at home at family student housing. And it just felt like my turn. So 33 and a half years ago, I had my second child, and he was born at home. And as soon as he was in my arms, I was just like, I'm not a professor, I'm a midwife. And so it was still not legally licensed in California, but that didn't, and I was still kind of a young single mom, but both of those things just kind of paled in comparison to the call to midwifery. So I'm apprentice trained. I did a 3-year apprenticeship and a 2-year junior partnership. And in 1997, California had completed the process for licensing us. So I'm like licensed midwife number 53 in the state. I know. I think I was in the 3rd group of midwives to get licensed, but there were very, very few of us. And so, that's how I got here. Wow. I know.
And so cool that like you knew from such a young age, and then kind of like took a little detour, but then came back to that.
Right. Really, and I think that life is like that a lot. Yeah. And my children are definitely my course changers. So I have this 41-year-old and 33-year-old running around on the planet, and we did it together. Wow. Super fun.
So cool.
Yeah.
Fascinating. And then could you maybe just explain a little bit of like the difference between an OBGYN, midwife, and doula, and when each might be appropriate, or when
Sure.
multiples
Right.
of those things might be appropriate?
Yeah. And so I think starting, I feel like birth, of course, is a very natural physiologic process. It's been going on, mammal birth, since as long as we've been mammals here, and for humans, incredibly successful for our species, 8 billion of us currently. So that I think most babies, probably 80+%, get safely born without the support of any outside, or without the skill set maybe of any outside person or influence. But I'm the kind of midwife who practices on a continuum of care with other support people. So I work with a backup physician with a specialty in obstetrics, so that I can collaborate on cases that need more medical input, or so that I have someone I trust to transfer care to for mamas or babes who need medical care. So a doula is, and they're making a huge resurgence, incredibly valuable. A doula, for the most part, offers emotional and physical hands-on support for a mama through pregnancy, but primarily in labor. They don't necessarily have clinical skills or medical decision making to manage care, but they're kind of a one-on-one personal relationship for mom, which is missing in so much of our care for mamas and babes in pregnancy, maternity care. And, over 90% of babies in this country are still born in the hospital, where you're not going to have a relationship with the nursing staff. And, unfortunately, I think, but as it is, nurses who are lovely have 1,000 other responsibilities besides providing emotional support, and they certainly can't provide continuous emotional support. So for anybody choosing to birth in the hospital, whether they're choosing to birth with a midwife or a doctor, I would say a personal relationship with a doula is essential. It's someone throughout. They don't shift change. They know you before you go in. They go with you and help, all the way from ice chips to verbal encouragement to massage to aromatherapy, all of that. So that's a doula. And then there are kind of two types of midwives, and there is some overlap. So there's licensed midwife, certified professional midwife, certified midwife. That's all the kind of midwife that I am. And then there's certified nurse midwife. So certified nurse midwife is a licensure that's countrywide, and for the most part, women, because it's for the most part women, but they're not all women, who have been nurses, loved labor and delivery, gone on for further education focused in midwifery. For the most part, certified nurse midwives work with a physician and in hospitals, but not all. Some work at home, are working what we call community birth, home or birth center birth. And then their training is in nursing, and then an extra training in midwifery, maternity care. And then most what we call certified professional midwife, CPM, certified midwife, CM, or licensed midwife, LM, is different by state. So certified professional midwife is a national certification, and then each state has different regulations about what that means in their state. Most of those, also mostly women, their training is purely in midwifery and natural physiologic birth, and then clinical management of that. And there's an overlap of medical skills by state as those are necessary. So I am, and we mostly care for low-risk women. I believe that midwifery is really well supported by having a relationship with supportive doctors, so that I can consult if somebody's, glucose numbers are high or iron levels are low, or the growth that I'm measuring from the outside is not what I expect, and we can get an ultrasound and that sort of thing. But we are also, I'm neonatal resuscitation certified, carry resuscitation equipment for mom and babe. We do IVs for fluids or antibiotics or management of hemorrhage. We carry anti-hemorrhagic medications, antibiotics, suturing. So we do have a set of medical skills for both emergency management and just management of normal events in labor and birth.
Mm-hmm.
Yeah. And
Awesome.
then, OBs in general are doctors who do all their medical training, and then they go on to do a specialty in obstetrics. Most OBs work in the hospital, I think almost all, and their training is more a medical orientation. And I can talk a lot more about natural orientation versus medical orientation, if that feels.
Yeah, I was actually going to say too, you used the term, I don't know if this is a good segue, but you used the term natural physiologic birth, and that might be something worth elaborating too, because it's not something I don't think I've heard until I heard you use that term, and then now I see it in other places,
Right.
but I think that's
physiologic birth.
Like, I think that's not a super common thing that's discussed.
People hear about, okay, or that language for it. So the idea of physiologic birth is like grounded in we are mammals, and mammals work, successful mammal species work, and humans, there are 8 billion of us. And so what are the natural / physiologic conditions that support our birthing? Like, why does this work? Why are there 8 billion of us? Why do we mostly, as a population, have successful live birth? And Sarah Buckley is a researcher who writes a lot about that. But what we know is that when moms feel safe, supported, and private, birth tends to go most smoothly. And most hospitals their strong point is not a setting that women can feel safe, supportive, unobserved, private in. So you can think of like, what setting is physiologically ideal for having a bowel movement? Similar, what setting is physiologically ideal for falling asleep? Similar, what setting is physiologically ideal for having an orgasm? So those are the things that I talk about. So a lot of the focus of our training was trying to head back toward what's physiologic, support what's physiologic, best support the mammal organism with a big brain in going back to what's normal and physiologic.
Thinking about most horse people would know, or animal people would know that, like, when there's an animal that's in labor, the best thing often is to kind of keep a watch from a little bit of a distance and make sure that they're feeling, like you said, like private and undisturbed and supported, but intervening when necessary, but really kind of letting the animal do what it knows to do already. And somehow that doesn't always cross over into human.
Totally. I think it's a great testament to human births that so many babies can get born in the hospital, that labor does persist, because for most mammals, as you see, if you interrupt them during labor, their labor will stop until they go to a place of feeling safe, supported, unobserved again, or you see animals go find that quiet, dark corner. And that's what lots of women, thinking of one woman in particular, will do when it's time to birth their baby. They'll go find that small, quiet, private place. And I think with people, it takes a lot of working with our brains to allow that for our bodies. So a lot of the work, as you experienced in a midwifery role, I'm fortunate where I care for, 1 to 7 or 8 birthing women a month. So I'm, generally caring for maybe 15 to 30 women, but I know them all. We spend an hour together every prenatal visit, and a lot of it is just relational and helping a mom go back to her body and where its own wisdom is.
That makes so much sense.
I know.
And it feels like it makes sense, right? Like, and it kind of feels like, how did we veer so far a different direction, which is just also really interesting.
Right. Well, one of the things that I think is really important, and that not all midwife or birth focused media or information, is that birth is risky.
Mm-hmm.
It's risky for mom and baby. It's one of our most risky life events.
Mm-hmm.
It's also successful almost all the time, but I think that's where we veered off course, is when women are under-supported, undernourished, and then birthing on their own in less than ideal conditions. There is a risk. There's risk of hemorrhage, there's risk of babies not making it. And so in our drive in the 30s and 40s, primarily to improve those statistics, we moved away from trust in the natural system to kind of an idolization of the medical system. And we're still working to find a healthy balance between those things.
Yeah.
So I think that's what we're striving to do, at least in my way of practicing, for each mama baby to find the best balance of support for that natural wisdom and medical, clinical, social intervention when we need.
Are there some kind of tangible things, thinking about that balance and the support for particularly athletes or otherwise highly active people? I'm thinking about mostly, like, I have a lot of farmers and equestrians and things like that these videos are typically reaching, but potentially other athletes as well, that maybe some benefits of that lifestyle in pregnancy, as well as maybe some risk factors or things that maybe they need to be looking out for to know that, like, they're not pushing too hard, or because the culture also of both, most athletic cultures, but also farming and equestrian cultures, tend to be very, like, push really hard until you physically can't go anymore. And my experience was that pregnancy was a time to really actually tone back a little bit and listen more to my body a little bit more, and not push so hard.
Right.
If that makes sense.
Totally.
So maybe, like, what are some things to be thinking about, both in terms of benefits, but also maybe
awareness.
Yeah.
Sure. So I love working with active women, because you're in your body more. And that's a great place to start, just like knowing your body and using your body. Because it gives us a lot of material to work with. And I can talk about some things that you may want to be aware of or avoid or this or that. But I think, kind of what I work with, and it's so individual, but that learning where your softer edges are, because there's a part of pregnancy and birthing that is like the more blossoming flower, the more softening and opening. So a lot of times, like you're saying, especially runners or equestrians or gymnasts, we're holding everything up and in and pushing. And that's great. And when you're pregnant, you're also growing a baby and learning to soften and open and respect other places within you. So I talk about when you're not pregnant and you're an athlete, you're always looking to find your edge and move it outward, like further, do more. A way of thinking when you're pregnant is to look at your edge blissfully, with a soft gaze. So it comes in a little more because you're focusing on different things instead of like triumph. It's softened into. Things like a yoga practice can be really helpful because they naturally include that finding the edge and softening back, the inhale and the exhale, or, finding your edge with a stretch and softening into it. So it's this continual work on honoring all parts of ourselves. So that part that's like push, hardcore, more, faster, stronger. And also the push that, or the part of ourselves that's like soften, melt into, soften your belly, soften your pelvic floor, soften your cheeks. But it's still working with the body and knowing the body and fully inhabiting your body.
That makes a lot of sense. Yeah, I remember a couple of things came up, a couple of little memories while you were saying that. One was that you had said at one point that so many, like, I feel like a lot of the advice around preparing for labor that's just generally out there talks a lot about pelvic floor strengthening and leg strengthening and things like that. And I remember at one point you saying that it is also equally as important to learn to relax those things.
Totally.
Especially as an athlete that tends to hold those really tightly, that there actually is a moment where you actually want to stop strengthening.
Yeah.
And learn how to like let those go a little bit.
Yes. And that's it. Exactly. We want to have an awareness and relationship too, so that we can hold strong and be strong and soften and allow, and especially to soften into intensity. As you know, you pushed a baby out, that it's crazily intense, and it's different from holding up and in. So I know I had a runner, I think she made the Olympic trials, she was a hurdler, and I really learned a lot from her because we hadn't talked about that softening. And I mean, her baby is probably 25 plus years old now. That it was like, there was too much up and in without the balance about. And I think as a culture, we don't talk about softening into really attending to when we need more rest, more food, more drink, more hugs, more tears, more softness. You know, it can't only be that, and that's not the same as couch potato or lazy, but it's both, like replenishing. I hope I talk a lot about replenishing when you're pregnant.
Yeah, that makes a lot of sense. And I remember also, like, for me, I remember you asked kind of what my plans were with work, and I was like, well, like, I'll work as long as I can, and I kind of like threw out a date, and you were like, oh, like, we'll see if you get that far. And I remember just kind of being like, okay, like, I guess we'll see. And then it was not quite that far, and I remember, like, I called you and I was like, I almost passed out at the barn.
Yeah.
And you were like, hey, no more horses, like, time to like put your feet up
It's
and
too
relax. Like,
hot
too
to
hot,
do.
too much. So like there's also, I think that like hopefully not everybody gets to that point of like feeling that, but I just remember that kind of very stark, like, okay, like my body said enough is enough. And I, you know, in hindsight maybe would have caught on a little bit sooner than that, but I think I still kind of had a little bit of that, like, have to finish this and take care of my horses and take care of my clients and can't ask for help and all of those things that I think would have been good to maybe, I mean, you said everything that needed to be said, but for me to just accept that a little bit sooner, I think would have been helpful ultimately.
But you can't really imagine
Right.
that your body's going to be there,
Right.
you know, or that your hormones and your emotions are also there. So it's, you know, it's physiologic in all the complex ways. And, you know, likening it to having a bowel movement, falling asleep, or having an orgasm. Because if you want to make love with your partner really nicely, you're not going to work up till the moment and then turn around and try to make love. You know, you generally have some transition period so that you're there. Same with having a baby, same with falling asleep. You know, it doesn't work so well if you just work and then try to go to sleep. There needs to be that transition period. But almost everybody gets there. They're like, oh, I'm going to work until I'm, you know, and some of us need to work. I want to really honor that. Some of us benefit from working, but to be able to have also that place where we're more private, we're more nesty, we're more slow, or we're able to have our own rhythms, or we're not working 16 hours in 110 degree heat. You know, softening.
Yeah, that makes sense. Yeah. And then what about postpartum as well? Like, I think that also tends to be kind of something that we're like, we're going to get through this and get right back to work. And like, that actually is one piece that I did plan to take more time, and I ended up not really wanting to take that much time. So I still tried to push the restful period as long as I could, but I feel like I didn't quite use as much time as I had planned for.
And was that a good balance for you?
I think so, because I think ultimately I was able to really listen to myself and go back when I was ready and not when I had this like timeline.
Yeah.
So is there anything maybe to think about there with like, you know, having a more active lifestyle, and it is hard to like sit in bed for several days when you're not used to that.
Yeah. Or when you have an idea about that, or like, I'll give it 2 weeks or 4 weeks or 6 weeks. I think what you said about listening to your body is one. The other thing is, I also come from a place like nature makes a lot of sense. And there's a reason we feel a little crappy postpartum, or, things ache, your breast aches, your bottom aches, your shoulders ache because you're holding your baby, your emotions are like this. Like, we're not supposed to run out back into the world. We have this little new nervous system here that so intensely needs. So if we can honor that the system, and mama and baby are a system, that it makes sense, then you can create that space, I think, a little bit easier, like checking out of the ideas in your head and checking into that like natural physiologic system, mammal system. Like, baby can't move around yet, so maybe you're not supposed to be moving around so much yet. Like, coming from there as a start. And then I have all these like little sayings and guidelines about first 2 hours, first 2 to 3 days, first 3 to 5 days, first 2 weeks, kind of rings of nervous system and physical system needs and support. But I love the idea of really allowing a lot of room to then find your way and listen to your own body and your relationship with your baby, because it's a relationship.
Yeah, that makes a lot of sense. Also,
yeah, just seeing
everything you're saying is like,
yeah, because nature makes sense. Nature makes sense. And there's an old book called The Continuum Concept. Jean Liedloff is the author. She was an anthropologist, and she was studying back when there were civilizations that had been as yet untouched by modern world life. And she wasn't intending to look at child rearing practices, but it was part of it. And it's like, oh, they wear their babies till their babies can move on their own. Oh, they start chewing and feeding their babies when their babies become interested, sit up, start to get teeth. It's like, the system makes sense if we listen with our heart body, mammal body, rather than this frontal cortex, which is great for banking, not so good for birthing.
That makes a lot of sense too.
Yeah.
So on that note then, are there like maybe some resources that you would recommend people look into, like maybe a favorite book that you always recommend, or like if somebody is looking for a midwife and they're not sure where to
not
go?
Specific necessarily to exercise, but just in general.
Yeah, just generally.
So I think a couple more things maybe about exercise that I tell athletes is, make sure your calories in match your output, which we don't always have to do, and your rest in matches your output. And then to be aware of some of the physiologic changes in pregnancy that may make injury or balance a little bit different. So I don't remember if or when you noticed like the jarring of different kinds of riding were different in your body. So to really be listening.
I remember it was almost like one day to the next, like it was comfortable and then it was not comfortable.
Right.
And I was just like, okay, I guess I'm done. Like that's
because you're a good listener to your body. Yeah. So just to encourage people to really do that, especially if they're in impact sorts of exercise where you might see that more, or to know that stretching and weight bearing may be different as your body moves through pregnancy. I'm going to look at this again. It's fine. And so resources, I love Ina May Gaskin. She was the one with Spiritual Midwifery. She has Guide to Pregnancy now. I have a resource list, so it has that on it. It has Sarah Buckley. She's so good for just like physiologic birth. And then you can kind of decide for you where you want to go from there, or for any pregnant person. But knowing kind of what's most physiologic. And what else did you, if people want to find a midwife, the North American Registration of Midwives, or that's NARM, or MANA, Midwives Alliance of North America. I think they both have national registries. And then each state will also have its own registry of midwives. What else do I recommend? I think, those are my biggies. There's Birthing from Within, which is a great book about the more emotional, creative aspects of pregnancy. There's so much available now on media, and you want to be careful about that, rabbit holes and all of that. But really, like, to find women you resonate with in your community and to listen to your heart body. And what I want women to know is all, or birthing people to know, is all their options, so that we're really choosing. Because if we only know people who have birthed in the hospital, we don't know that we have other options. If we only know people who have done it a certain way, I want people to know their options and put together a custom plan that's appropriate for their current health, healthcare philosophy, their little babe, their relationships, all of that.
That makes so much sense.
It all makes sense, kind of, right?
Totally.
And then we get the mystery of it all the time, too.
Yeah.
You know? It's kind of like just walking alongside the mystery and supporting it. You know, plenty of sunshine, plenty of rest, plenty of water, healthy food, exercise.
Yeah. Is there anything else you feel like you would like to add, or that you feel like comes up often that I missed, or that?
Yeah. I can't think of anything. Just, it's birthing, being pregnant and birthing is an amazing, strong thing. And I really think that it should be better supported than it is, and to really access all the different ways of supporting that.
Yeah, and it seems like something that hopefully people are, maybe if that wasn't clear before, for people that have found this, that maybe there's some like understanding that you can also kind of create your support team, that you don't necessarily just have to like go to your local hospital and go with, you know, who's there, who's on call, but that maybe there's actually some ability to take some control of your own story a little bit.
Right, and now there's so many different birth classes available online, or you can find a doula. You can custom make the package. I think families are better supported through the postpartum period when they've been supported in making powerful and personal decisions for all of it. Yeah. How do you feel like it facilitated your journey to kind of maybe have chosen midwifery care or a different way of doing it?
Yeah. I mean, I feel like I've never really felt safe in a hospital. So I knew right away that I wanted to look at other options. And I was born in a birth center. So I already kind of knew that there were other options. Right. But I was also a little bit skeptical of home birth because my dad is a paramedic, so I've heard the horror stories. Right. So I've heard the how it can go wrong. But I think all those horror stories were really people that it was not a choice. Like they had planned on going to the hospital and they didn't have the prenatal care and they didn't have a plan for a safe and supported home birth, and it ended up unfolding that way for one reason or another. Yeah. And so after talking to you, that was when my mind kind of opened to the possibility of like it can look any way that I want it to look. And it doesn't need to look like anything I've seen before or how it looks in the movies, because that's really not the experience at all. And actually I don't really know anybody who has an experience like it is in the movies. No. Even like the worst case scenario, people are like, it's not that bad. I think it's really different. So I think that was really big for me. It was just being able to actually like talk to different people and kind of open my mind to different options. And then even at one point I went to like a prenatal circle, and there were people on all ends of the spectrum, all the way to like free birthers, which is, that to me felt like really pushing the envelope in a way that made me feel uncomfortable. And then it was kind of that moment to like examine why that makes me feel uncomfortable and what about that felt like maybe not something I wanted to be part of my story, or things that maybe were appealing about that, you know, why maybe some people were drawn to that. And just the idea that each person can do what really works for them, and it doesn't have to be this prescriptive,
a template placed over. That's what I would encourage for all people seeking care, is that it should be relational and guided by the pregnant person, you know, and you choose a care provider who hopefully has a broader experience, but there's nobody like you who's going to be an expert in you and your baby and your desire, you know, the path you want to walk. So.
Yeah. So good.
Yay! Absolutely so fun.